Let's start the show.
Hey guys, welcome back to another episode of the ACM show. First one we're doing virtually, and it's with our one of ACM's locums from a few years ago. Jack Williams has become a great, addition to the ACM team, extended team. So, how you going, Jack?
Yeah, well, thanks for having me on. Looking forward to having a chat.
Definitely. It's usually the other way around. I'm usually on your podcast.
It is.
Yeah.
Yeah, we've had some great chats recently.
Yeah, definitely about pay, about aged care, about how the pandemic has been affecting everything really, but especially in healthcare. So yeah, how have you been finding it anyway?
Coping with it okay, fortunately. Yeah. Being in aged care at the moment has been a big help in that regard. Definitely over the last year or so.
Yeah, definitely. Well, let's get into it. So question one, Jack Williams, what's your fondest memory of ACM Healthcare?
Oh, how could I forget my first locum? So I graduated at the start of 2018, and I got registered in March, and I had a job lined up in April, May. So I had a month, and I looked into this locum thing, and I saw an ACM advertisement and responded on a Thursday. And on the Monday, I was in another state starting my aged care locum. It was very quick. I was very impressed.
Oh, thank you. We have to move quite quickly, especially on that one in particular. It was very short notice, so I appreciate you taking the time to actually do it.
I remember because it was very new territory for me. I remember talking to yourself on the phone. And I remember the information and the plan that we had, and it all came together. And it seemed like it was a pretty seamless experience. I really enjoyed it.
Definitely.
It was your first. It was kind of both of our first locum, if I recall correctly.
That was about the time I just started, and it was right in the deep end because I had to get quite creative with what the budgetary restrictions that I had at the time. And I had to get creative with accommodation, had to get creative with your modality or your transport, as well as take into account what we wanted to pay you and what you were sort of asking for. So I guess it all worked out in the end.
It sure did.
Yeah,
I remember also being picked up by Ivan a few times, which was great. Yeah, amazing.
Yeah.
We had a few good chats actually in the car. That I actually learned quite a lot just about the nature of locuming and ACM as a growing national service with like lots of jobs available in different states.
Yeah, wow, definitely. And it was that was on our end. I think we found out you just arrived at the facility, you had all your bags and everything, you hadn't gone to the accommodation yet. And then we asked you how you were getting there, and you were saying, "Oh, I'll probably catch a taxi, maybe catch a bus." And I went straight to my director and I was like, can we pick him up? Like, can I send Ivan out there to do it? And he did. I was going to go get you, but my car wasn't that great. So I thought Ivan's car would be better.
It was a nice car. I remember that.
Definitely.
Yeah, thank you. Awesome.
So coming out of uni, did you always want to work in, aged care, or is that something, you fell in love with, or why do you actually work in aged care as a physio?
Well, like most grads leaving uni, for me, aged care wasn't even on the table. So it was just that classic toss up between private practice or working a hospital job. So I was not familiar with residential aged care homes at all. I'd worked with a lot of elderly patients, but not in the aged care role, which was my first locum. So as to how I came to work in aged care full time, like I do now, I guess it was a combination of things. When I left uni, I also wanted to travel. And when I combined that with what I learned about these locum opportunities, particularly from you guys, it seemed like too good an opportunity to not explore. And I kind of went from there, really. So this was 2018 and 19. So I locumed in Sydney, Gold Coast, Hobart, Melbourne. And I'm in Melbourne at the moment where I work. That's how I started. I have actually done hospital and private practice in the 3 years since I've been out. But why I like aged care, I really enjoy the mix of neuro and respiratory and MSK work that you get in aged care. So it's a really great mix of different disciplines. Um, and you also have a significant opportunity to make big changes with the residents, as you end up spending a lot more time with the people that you work with than you would in a private practice or a hospital ward prior to discharge.
Okay.
So that's something I've really come to enjoy, and you get into your rhythm and all the residents you work with. And yeah, it can be hard to move away from.
Yeah, wow. I never actually thought about it like that. I mean, with hospital, you get discharged, you don't really see that patient. Maybe they might come back for some, I guess, follow up appointments, and same as private practices. They come
Or
up.
worse, if they come back to hospital.
Yeah,
But
exactly. I
yeah,
mean, you don't want to see them again, ideally, but I mean, injuries happen, and it's a really good way to think about it. You're actually building that rapport and building a relationship with the residents.
it is. It's very unique to aged care, and it's something you only experience if you spend more than 6 months. I
Yeah,
will say
well,
that it
wow.
takes a little. You have to get into the rhythm of it, but yeah, it's yeah,
Yeah.
good fun.
So I got a bit of a tough question.
Yeah.
If you if you could change anything about aged care, what would it be?
Oh, that's an easy one, and I'm not the only one here. That would be pain management programs all
Hmm.
the way.
So
Um,
that's your 4A and 4B treatments, correct?
Yeah, so it's a framework that dictates how we deliver treatment for a lot of residents in aged care homes. And it's a very well known problem that the focus is on passive treatments like manual therapy rather than exercise. And fortunately, there's a lot of scope for interpretation here and ways of working around pain management to be more effective.
Hmm.
But that, of course, very much depends on where you work and being in the know. And it's something we've talked a lot about on the podcast.
Yeah.
So it's good to know people like Pierre, who knows who's good and who isn't to work for.
Hmm. Absolutely. No, that's great. Great insight, actually. Yeah. Would you say that do you think it actually garners results though, pain management programs, or I guess I'm assuming, look, with your treatments, it sounds like you're a bit more creative in actually getting results for the residents. Would you say that?
Yep.
Yeah.
Yeah. So I guess the main complaint about pain management is the end goal and how effective they are. So if you took them just by themselves, like doing massage for 20 minutes on one particular area for a resident 4 times a week, you probably won't feel very effective in what you're doing, and you probably won't get as good a result as you would if you did what physios and OTs are trained to do,
Yeah. Excellent.
which it does diverge from in its current form.
So now we mentioned this earlier and how the tables have turned. Um,
Mm,
and you do actually run your own podcast called the Health Linked podcast, which generally I'm a guest on once a month.
yeah.
How did that come about? I mean, what is it, and why did you decide to start it?
So yeah, it's the podcast and Facebook group, and I started it for a lot of things really. The main reason was to answer all the questions I had as a student about career pathways and big questions in health. So questions for other health professionals and how to communicate better between disciplines. Um, and it's kind of become an outlet for the questions I still have day to day about the problems that I have.
Right.
So concepts like um, interpretation of pain management, which we've talked about on the podcast previously, but also things like burnout, pay scales, and negotiating pay. Um, the current job market updates that we get from yourself, which are really great. I enjoy those. Um, Trends in industry, like the ANAC assessor chat we had recently, and clear guidelines on social media use. Yeah, just the big questions about the future of healthcare.
Yeah.
Um, and we're always learning something there.
Absolutely. I mean, it's always evolving, the industry, and not just this industry, but every industry. And yeah, it's important to see people who are actually working in the field, talking about things that they notice, or things they think they might be able to change. So yeah,
For
absolutely.
sure. Yeah, I've been impressed like how quickly it has changed. Particularly the chat about annex assessors. That's it's very new information, and it's still not being implemented in many parts of Victoria. But it's a really big change that's going to affect a lot of people. So it's good to be across.
Yeah, definitely. I mean, it's a very slow burn. Anything new that's being implemented does take a lot of time. But I mean, in saying that, when I started at ACM Healthcare, they were saying they were going to make changes to ACFI. And before I started that, my directors were saying they were going to make changes to ACFI. So for us, it's like, oh, this is out of nowhere. But really, it's been in the works for years. It's just starting to roll out now. Yeah.
Absolutely.
With with the podcast, what's the ultimate goal for the podcast? What do you want it to be? I guess at the end, what's the goal for it?
Um, I guess the ultimate goal for me is to answer all the questions I had when I was a student and present it to the current students that are coming through their programs. And that's from different disciplines, not just physio, so OT, speech. I think I'd really like to change the question that people ask when they leave uni from just, do I work in private practice or hospital, to include areas like aged care, occupational rehab, NDIS, and community work, which in particular is going to be huge. I know you know that. Moving forward, and these are all the areas that they don't get exposure to during their training process, or at least I didn't. So I'd be really interested to change that conversation.
Yeah, absolutely. No, and I think definitely that's what you are becoming. Would you say people are able to actually reach out to the Health Linked Facebook page or get in touch with you if they had any questions? Is that something you
Oh,
want?
absolutely. Yeah. So on any platform you come across the podcast, like LinkedIn and Facebook are the big ones. And we have a website where there's a contact form. You can jump on there and ask any questions if you want to get in contact.
Yeah.
And in terms of what I'm going to keep working for, I guess keep answering or asking the big questions. And I've always been really interested about concepts like burnout, which you see in a lot of health-related media, and also talking about pay scales and negotiating pay. We've had some really good chats on the podcast recently. Because all these questions I found you can't necessarily get a good answer from your employer or even your mentor in a workplace, because there's a significant conflict of interest usually for them answering a question like that. So it's good to have an outside source and an industry contact like yourself. Just to be across areas like this.
Yeah, definitely. If I could add on, I think it's just very important to know what the market rate is for a physiotherapist with your particular experience. I think is the best thing to do.
Yeah, and it's not clear cut at all, and it's very difficult. It's quite difficult to discern more areas than one. So
yeah,
get in contact with Pierre if you have any questions on that for sure.
And also get in contact with Jack for anything physiotherapy or healthcare related. He has a lot of answers himself.
Or just have a listen. We're on Spotify and Apple Podcasts.
Nice. Yeah, definitely. Health Linked podcast. Make sure you check it out, guys. That's it, guys. That's the ACM show. Thank you so much to Jack for actually coming on and talking about, I guess, his inside knowledge about working as a physiotherapist in the aged care sector. How was your first time on the show?
I enjoyed it.
Yeah,
loved it. The tables have turned.
Definitely, maybe you should do the Health Link podcast with video too.
Ooh, yeah, it's got some more editing skills that you need to cultivate there. I'll leave it to you.
Yeah, you can send it this way if you'd like. I don't know. But again, if you guys want to get in contact with Jack, you can do that on Facebook or visit his website, fill out the contact form, and of course LinkedIn as well. You can get in contact with him. Again, thank you so much for jumping on, Jack.
You're welcome. Thank you for having me.
No worries. I guess I'll talk to you in maybe a few weeks on the Health Linked podcast.
Very soon.
Sweet. No worries. Thanks for that.